Congratulations! You have now reached the third trimester of your pregnancy and you are planning to have an elective caesarean section. This short video has been designed by professionals to give you some advice on what happens immediately before, during and after the operation, and talk you through the problems that can occur with all types of surgery. We hope that this, in conjunction with your leaflet, will be helpful in your preparation for your operation. So, why might you be having a caesarean section? One of the common reasons for having a caesarean is because you had one in your previous pregnancy. Most of the time this doesn't mean you have to have a caesarean, but occasionally it is considered necessary. Another reason is that your baby may be facing the wrong direction, or there may be other medical reasons why it might be safer for baby and mother to have a caesarean section. Normally, this is done at 39 weeks. Prior to the operation, we'll invite you to see the anaesthetist in the pre-op clinic, where we can take blood and answer questions as well as explain what you can expect on the day. During the operation, there may be a large number of people in the operating theatre, so we'd like to introduce some of them to you. Firstly, there is the anaesthetist. Then there is the midwife who will be looking after you. There may be two obstetricians, one to assist and one to actually perform the operation. And once baby is born, baby will be handed to the paediatrician. For the anaesthetic, most people will receive either a spinal or an epidural anaesthetic. This will involve placing a fine needle into the base of the spine. You will be asked to sit on the operating table and bend forward a little. The common side effects you might feel include nausea and shivering. Once the anaesthetic is working, we will lie you down on the bed, usually tilted to the left-hand side. Your partner will be able to sit next to you behind the screen. The incision is usually just below your bikini line. The time for the operation is approximately 30 to 45 minutes. It only takes 5 or 10 minutes for the baby to be delivered. The rest of the time is spent delivering the placenta and sewing up your tummy. Once the baby is born, the cord will be cut and the obstetrician hands baby to the midwife, who takes baby to the paediatricians, who will make sure baby is okay and that there aren't any immediate problems that need to be addressed. This normally takes only a few minutes, and then baby will be passed either to you or to your partner. Very soon you will be able to breastfeed your baby. Soon after the operation, you will be transferred onto a bed and taken to the recovery room, where you will be monitored for a short time. During this, you will be able to continue breastfeeding. The midwife will weigh the baby for you, and after a couple of hours in the recovery room, you will be transferred back to the postnatal ward. Occasionally, if your baby needs a little more help in the first few hours or days of life, he or she might be taken to the neonatal ward, where you will be able to visit regularly. After the operation, you will probably feel quite tired, and you'll be given plenty of opportunity to rest. You are likely to have a catheter in, which is normally left in for at least 12 hours. You'll be offered pain relief for the scar. By the following day, you will be able to walk, and usually people are able to go home within 2 to 3 days. No surgery is without risks or complications. We will briefly cover the common complications, but also the rarer but serious risks. About 9 in every 100 women have wound discomfort. 6 in every 100 may have an infection, but we give antibiotics routinely during the operation. There is also an increased risk of repeat caesarean section in future births. Serious complications that are uncommon include having to have an emergency hysterectomy, which occurs 1 in 1,000, Further surgery is sometimes required in about 5 in 1,000, and admission to intensive care is required 9 in every 1,000. Rarely, one can develop clots in the leg or lung, which is why you're given special stockings and blood thinning medication after the operation. This medication needs to be taken by injection into the skin for 5 days after the operation. Injury to your bladder is another rare complication of caesarean section. For further information about caesarean sections, you can always talk to your midwife or take advantage of the leaflets available. Thank you for watching, and we hope you have found this video useful. The video was created by the Royal Devon and Exeter NHS Trust and Peninsula College of Medicine and Dentistry. We value your feedback on the video. Please go to the following link.